Hi everyone, my name is Rebecca Holes and I'm a licensed professional counsellor with Atento Counselling, and I am going to be chatting with you today about avoiding the trappings of short-term kind of crisis stabilization therapy into a longer-term wellness-based relationship with our clients. So I want to start, I guess, by just acknowledging some of the inevitable kind of restrictions that can be in place in order to prevent that more longer term wellness support from occurring. So what comes to mind for me initially is, a client's situation, their lifestyle, the frequency of which that they can attend sessions, or the ability that they have to commit to longer term therapy, but also the therapeutic style that you might use. Some therapeutic styles are geared more towards solution focused, kind of brief interventions of therapy. And also insurance companies. Insurance companies are always looking to understandably make sure that we are utilising our services appropriately and effectively, and that really is paramount. It's very, very important that whatever time we are spending with the client is valuable, is necessary, and that we can speak to that in our notes. So certainly I want to be clear that this exploring longer term therapy as an option is not a way to just elongate what could be done in a shorter period of time. Absolutely not. We want to be succinct, we want to be effective with our clients, but we also want to explore, is there an alternative to just very solution focused, let's deal with whatever the presenting issue is, and off we go. So first, let's talk about what are some of the limitations of a more solution focused brief therapy. And I can just speak to my own experience with clients that I have worked with. And when I first started out as a therapist, I would take what the client said as the issue. So when a client walks into the room, whatever they said was the issue, and we would go directly into that, and we would be looking to resolve, alleviate, process that one specific issue. And in my mind, that meant I was doing a great job. I was a great therapist. We could resolve that one issue, the client experienced relief, and off they went. And I found that over time, those were the clients that often came back or needed to come back further down the line, or that the relief was temporary, and that very soon the old symptoms came back, just in a different form. So the analogy I will often use with clinicians when I work with them in consultation, especially around EMDR, but I think this applies anywhere, is that it's important to think about the client as a tree. So what the client, 99% of the time, what a client walks in the door with as their problem is not the problem, it's the answer to a problem. It's what the client is doing to stay out of something bigger or deeper. So for instance, if a client presents with anxiety isn't the problem. It's problematic, absolutely, but it's the answer to the problem. Anxiety is what the system is doing in response to something else that feels bigger, deeper, scarier. Alcohol. If somebody comes in and they're using alcohol, abusing alcohol, that's not the problem, it's the answer to the problem. So it really helps for me to shift that lens or that approach of, I'm not looking to just trim the tree, I'm looking to get to the roots of the tree. Because if I just trim the tree, those leaves are going to grow right back. They might be a different colour, different shape, different size, but they are going to grow back because the root of the issue still exists. And I like to present that metaphor to my clients quite early on, to just invite them to start to get deeply curious about how they've learned to stay safe in the world, how they've learned to need these tools and resources that they're coming with that aren't effective for them anymore. And that's I think more of an attachment-based approach that I tend to use, that I do find to be very helpful to, again, get clients to be quite introspective to looking backwards as well as looking forwards. So I wouldn't say I'm psychodynamic in my approach either, exclusively. I'll utilize it, and I do feel, gone are the days of years and years and years of therapy and lying on someone's couch and, delving into, I wish insurance covered that. Maybe if someone wants to do private pay and can utilize that, then great. But typically nowadays we're looking for something more in the middle. So not necessarily always solution focused and brief, but not exceptionally long either. So this attachment lens really does invite clients to look backwards as well as forwards. So we are going to be looking at coping skills, but we're also going to be looking at how did this problem get here in the first place? How did the system learn that this needed to be here, in terms of how I'm showing up in response to it, and then how can we really address the root of the issue? When we start to look at things through that lens, we are immediately looking at 10, 20, 30, 40, 50 sessions potentially to really be able to deeply explore some of those issues. Now, not every client wants to do that, and that's absolutely fine. What is also the most important part of any therapeutic relationship and alliance is that the client is getting what they want from therapy. So their goals are the most important here. If a client wants to get in and get out, and that is their goal, I want to work on this one thing and I want to leave, I will always honour that. I will, however, also invite them to get curious. So while we're working on that one specific issue, potentially, I am going to invite them to get curious about, I wonder how you learned that. I wonder how you learned that that was the way that you had to be. Because it's very, very unlikely that that client is experiencing that issue in just that one area of their life. So for instance, if somebody says, I'm very anxious about traveling away from home, it will be unlikely then that they experience no anxiety in any other area of their life. It might look slightly different, but the reality is it's showing up in different places. So while the client might want to focus on that one branch of the tree, to use that metaphor, I'm always going to invite the client to get curious on, are there other branches here? Is this extending into other areas? And more often than not, the answer is yes. And by inviting that curiosity, the client then oftentimes reshapes what they are conceptualizing to be an effective use of their therapy. Many times they will then transition themselves from saying, well, I don't just want to address this thing, I want to address some of these other things too. I might want to address this thing first, but then I would like to transition into some of these other areas. So that is one way that I have found that really helps clients to look a little deeper into what they're experiencing and to kind of draw back and say, okay, how is this part of a bigger picture? So that's something that I think is difficult to do in really brief solution-focused therapy. It's not the goal of solution-focused therapy necessarily to really look back and all out and see how these are part of big, greater patterns, and that's absolutely fine. But if you are looking to be able to really deepen that therapeutic alliance and have something be a little more long-standing and consistent, that's certainly one way to do it. So with that too, also inviting the client to look at what would the long-term benefits and impacts be of doing that deeper work. So again, sometimes clients are just looking for distress alleviation. So they want this one thing taken care of, and that will alleviate a problem, a right here problem for them in their life. I will often invite them to say, if you could address these things though, what might that mean for your life 1 year, 2 year, 5 years down the line? So that's another way that I really invite clients to reflect on how a more consistent and deeper, long-standing therapeutic journey for themselves could actually lead to much deeper, more fulfilling, enriching outcomes on the other side. On that note, and on that same theme, I will also really invite clients to dream. I'll invite them to dream of what it looks like to go past just functioning better and really look at what would life be like if you could function excellently. What would it be like if you could really thrive as opposed to just cope? So when it comes to developing coping skills, I don't tend to call them coping skills, I'll call them resources. And the difference there for me is that I want my clients to more than just cope. I want them to be able to navigate challenging situations, but I want them to learn more about themselves each and every day. So the resources that I might use with clients invite the client into a space of curiosity and a deeper sense of understanding themselves somatically, emotionally, right, and cognitively, to be able to learn something about themselves each and every time they work through that window of tolerance, and that they're widening it. They're aware that that's what they're doing. They're not just engaging in a down-regulation technique like box breathing or you choose. We're not doing it to cope. We're doing it to be able to learn and expand and thrive. So that's another way that I'll continuously invite clients into that space of curiosity in order to be able to promote that long-term look at what their mental wellness could look like and really how I can support that process. Many times with longer term care and well-being, it's not necessarily that I'm meeting with that client every week for years and years and years, right? It's really, really important that the client always know where we're going. We're not just going week to week, chatting it up, and just off we go. It's really important that the client knows where they're going, and that it's important that those client sets those goals. But the goals can absolutely be, here's what I'd like to be able to achieve by next week, next month. Here's what I'd like to be able to achieve 6 months from now. Here's where I'd like my life to be a year from now, 2 years from now. So if we think about it like a train, we're assigning all the stops on that train's journey. The client knows where they're going, but I'm inviting them to have multiple stops. And then from there, we can decide, okay, what type of dynamic or relationship frequency of services is helpful here. That might look like weekly sometimes to get to some of those stops. Sometimes it's every other week. Sometimes it's, all right, why don't you see how you get on for a month and then come back. That is also part of the therapeutic dynamic and the therapeutic alliance and the relationship. It doesn't have to be weekly, every week. In fact, I would say it probably shouldn't be that way long term. But what is going to facilitate that is safety in the relationship, is that the client knows that you are on that train with them, you are on that journey with them, and they can always check back in, and that you want them to check back in. You want to feel like that safe space for the client to be able to say, I'm really doing well right now. I'd love to check in with my therapist, kind of process how far I've come, process what might be next for me. I oftentimes will say that therapy should feel like a pit stop sometimes in Formula One, right? You just sometimes need a bit of a tune-up, a bit of a reminder of what those goals are, a bit of a reminder of some of those old habits and those old ways that might want to creep back in, and just help the client tune up, and off they go again. But you as a therapist remain that safe space, you remain that open space for them. And that's really important too. One of the challenges with that is, how do you balance your schedule? So I think everybody works different in this way. In order to keep our schedule how we want it, we need to balance taking on new clients, holding space for current clients, holding space for clients that just want to drop in. Everyone's different with that, but I would certainly invite you to look at, how is your schedule set up? Is your schedule set up in a way that you have a little bit of space for those returning clients that may just want to stop back in or may want to get back on your schedule? Personally, I am now at a space where I rarely take new clients because I do have a bit of a continuous turnover of clients that are with me, clients that we terminate services, and then they come back around a year or two later and they just want to check in, or something else has come up and they'd like to work on that. And that's what works for them. And I enjoy being that safe landing space for them to check back in as they need to. So I would certainly recommend take a little look at your schedule as well and see, is it working optimally for you, and is it working optimally for your clients? And I think the balance of that with also being able to invite your clients from the very get-go to look long term can really help work towards a nice space that optimizes your availability without having you sit around waiting for clients to drop back in, because that isn't ideal either, but also being able to plan that the clients that you've got won't just be with you for 2, 3, 4 sessions and then dropping off, but you can plan and say, okay, based on what we've looked at, based on what we've explored together, this is a client I can see working with me for the next 6 to 12 months. Certainly things come up, things can change, but it's nice for you as a therapist to be able to look long term with that as well and say, this is what I think my schedule is going to look like over the next couple of months, for instance. Another benefit of having this kind of step down, step up model of therapeutic care, I find, is that it really empowers the client to learn what their needs and wants are. Sometimes with shorter term, more solution focused therapy, it tends to be dictated by the therapist when that service ends. So it tends to be, right, when this thing is achieved, that's when you're done. And while there are benefits to that, there absolutely are. I oftentimes find that shortchanges the client really in being able to learn and deeply understand what they need and how they know when they are doing well, when they're struggling, somatically being able to understand themselves better. So I much prefer a step down, step up approach with my clients. So when we talk about termination of services, what that looks like. Do you want to just say, okay, on this day you're done? Sometimes that's absolutely necessary if the client is moving away, or the client is very sure that that's all they need and want, and then they're done. Outside of that, I will often invite clients to have more of a step down, step up approach. So that might look like going bi-weekly to monthly to once every 60 days or so, okay, just shy of that kind of termination time that insurance companies would like, and then invite them to check in at that point. Let me know, how are you doing? What might work for you? It really continues to invite the client to reflect, check in with themselves, and teaches them that longer term skill of being, the emotional self-sufficiency, being able to use the resources that they've learned, but also keeping the door open for them to be able to say, you're always welcome here. There is no shame in needing to check in. You are welcome to check in. That's part of your wellness journey. And just keeping that very open and invitational with the client within reason, I have found to be very, very helpful. What I have found to be a challenge sometimes, if clients just say, I'll let you know, I'll keep you posted, and you don't hear anything back for 6 months, and then there's another crisis, I need you. I will bring to a client's attention if that starts to happen of, okay, we're seeing a pattern here. Invite the client to notice the pattern of like crisis stabilization, disappearing, crisis stabilization, disappearing, crisis stabilization. That's very different than developing a long-standing therapeutic alliance and relationship with a client. So don't be afraid to bring that to a client's attention. That only has to happen twice for me. Like one time, they go away, they come back, and then they go away. And if that was to happen again, at that point I would say, I don't think this approach is working for you. I wonder if there is a kinder way for your system and for us to work together in a way that really helps do some of that deep healing to prevent this kind of all-in, all-out type approach with clients. A few other components to this field, this job that I think can really help with creating and maintaining that longer term alliance. And some of the more logistical pieces, being as consistent as possible, responding to clients' emails, responding to however they reach out to you, you know, to ask what your availability is. I know it's hard, it's busy, and certainly admin is a lot, but doing your best to show up consistently for your clients, being consistent in what you do, all helps for a client to know that you are there for them as they need it. I find that to be really, really helpful. That when clients check in, you know, I've had the same phone number, for instance, for a long time. They know how to reach me, they know how to get hold of me, and they know that I'm available, and that seems to be incredibly helpful as well. I'm a firm believer that no one approach works for everyone. And so it can sometimes be helpful to really diversify your skill set, diversify some of the approaches that you are trained in and that you feel comfortable in, so that you can adjust as needed as well. Looking at, you know, if a client comes to you and one approach isn't working, that might be an opportunity for the client to terminate services, leave, and off they go and try and find somebody else. If that's something that you're noticing, maybe exploring those additional trainings, boosting your confidence in some of those areas so that you can pivot as the client's needs require you to, but also that increases confidence as well in the clinician. And it reduces that possibility of like that panic and refer out. That's something that I see a lot especially in trauma. And a lot of the times, inadvertently, through no intention of the therapist, that panic and refer out can actually be quite a significant attachment rupture and attachment injury to the client. And many times it also really speaks more to the clinician's lack of confidence in themselves than it does to their actual skill set, especially when it comes to trauma, but this might be the case in other areas as well. But seeking consultation, looking at trainings that could be beneficial to expand your confidence in those areas can go a really long way, not only for yourself, but again, for the length of time that you can work well with a client, that you can be of assistance to the client. And even looking at, you know, does it feel ethical? Does it feel helpful to double up with someone that might specialize in one particular area? So sometimes I have clinicians that I work with who aren't trained in EMDR, but they'd like their client to receive EMDR. So they receive EMDR with me, continue to work with that client. Ethically, that can be absolutely acceptable. Obviously, each case is different, but as long as all parties are agreeing to that and that works to benefit the client, ultimately, that's certainly a way to work in order to avoid that kind of refer out tendency that can come up sometimes. Other really important considerations which are going to come up with clients is, of course, financial barriers. Doing what you can to work with a client, speaking with the administration, the teams, the GEMs, at Tento, but I'm thinking kind of more globally, looking to see what can be done to support a client through different financial challenges is always worth doing. Certainly there are boundaries there and there are, roadblocks that aren't movable, but it's always worth looking into because people's financial situation does change. Again, that's sometimes where that step down, step up approach can be an option. Access, and availability, travel, how flexible you can be as the clinician for virtual, in-person services. If you have flexibility in your schedule, that's always helpful. Again, none of these are essential, but they can always be helpful considerations as well to be able to bend and flex with your clients is inevitably going to help maintain the relationship for as long as is necessary. Will help towards it at least. But yeah, just another consideration. And then just being able to help the client forecast and plan for future shifts and changes. So if they're moving away to college, if they're transitioning in life in different ways, helping them look at, if therapy is important to you and therapy is helpful for you, that's self-care. How do you plan to integrate that self-care moving forward? if it feels helpful, if it feels clinically appropriate, helping them plan. Because many times, as we know, when things get tough, self-care goes out the window. And therapy is self-care. It's important. It's the best work you'll ever do. It's the most powerful work. It's the best gift you'll ever give yourself and the people around you. And sometimes people it's the first thing that people drop, when things get challenging. And that's another reason why we see that kind of crisis dropout type of approach. So inviting clients to look at, how is this something that will be beneficial for you to integrate long term from a self-care standpoint as you navigate some of these upcoming challenges, can also be, a really helpful way to maintain a longer standing wellness journey with your client. I hope this has been helpful information for you, and certainly I'm available to answer any questions and support anyone that could benefit from it in this area moving forward. Thanks so much. Bye.